Hey, baby.
When Tiffany Evans of Fort Pierce gave birth to her first and only child in 2013 in Vero Beach, her joy was quickly replaced by fear. Doctors told her little Noah was in respiratory distress and needed to be flown to another hospital for immediate specialized care. She says the call went out for air transport, but none was available on the Treasure Coast. St. Mary's Medical Center in West Palm Beach requested the Healthcare District of Palm Beach County's Trauma Hawk Air Ambulance, and the flight team responded, airlifting the newborn to St. Mary's Level 3 Neonatal Intensive Care Unit.
And 2 days later, I finally got to see him. But if it wasn't for the Trauma Hawk, I mean, he would have died. There was nowhere else to take him. To actually have him now, it's a blessing. He's my miracle baby.
All right, ice cream.
Jim KAPPES, an electrical engineer who serves in the Coast Guard Reserve, suffered high-voltage electrical burns to both of his hands in 2013 while working on an electrical panel.
In an instant, as fast as you could snap your fingers, my hands were cooked. My hands felt literally like someone was taking a potato peeler and just scraping the skin away.
Trauma Hawk transported the Royal Palm Beach resident to the trauma center at St. Mary's Medical Center and then to Miami to receive specialized care at the region's only accredited burn center at Jackson Memorial Hospital. The father of 4, with a 5th child on the way, credits the rapid care he received for enabling his hands to heal. KAPPES says, as a Palm Beach County taxpayer, he expects Trauma Hawk to cross county lines when needed.
I would want the same care for any other person, you know, even I may not know them. That's what I pay my taxes for.
Since the Trauma Hawk Aero-Medical program first took flight more than 20 years ago, the Healthcare District's 2 air ambulances have provided safe, rapid transport to more than 14,000 patients. It's a program that has earned the respect of Richard SHERLOCK, a retired U.S. Army Major General who held senior positions in the Pentagon, served as a senior Army aviator, and now leads the Association of Air Medical Services, the only international trade association serving the entire air and ground critical care medical transport community.
Trauma Hawk is a very well-respected program both regionally and across the United States for the capabilities and practices that they bring.
Every year, the Trauma Hawk Aero-Medical program receives similar praise from hospitals and agencies that Trauma Hawk has assisted. In 2012, the then Broward County Sheriff sent Trauma Hawk this letter of appreciation for coming to that county's aid while their Aero-Medical helicopters were out of service. And in 2005, when Hurricane Wilma struck Palm Beach County, an Aero-Medical provider from another county flew to this former Belglade hospital to airlift patients to safety when power was lost. SHERLOCK says those who criticize Trauma Hawk for providing emergency transport assistance to hospitals and patients outside of Palm Beach County don't understand how Aero-Medical programs should work, and that these aircraft that fly at speeds as fast as 3 miles per minute should not sit idle if there's a critically ill patient who needs rapid, life-saving care.
That's why you need to get the patient from wherever they are to the most appropriate medical facility, and that in some cases may be outside of Palm Beach County. It's all about the patient. You can have a wonderful transport program, but if you're not focused on the patient as the primary reason for that transport, then you're not focused on the right thing.